Welcome back to our series on liver disease. Today, we're covering the most advanced stage, Stage 4, End-Stage Liver Disease, ESLD. While this stage represents a critical point in liver disease, it's important to remember that ESLD doesn't mean the end of life. There are still steps you can take to manage the disease and live as fully as possible. Let's dive into what ESLD means and what you can do. What is end-stage liver disease, ESLD? End-stage liver disease, or ESLD, refers to the point where the liver can no longer function properly due to extensive scarring or damage. This is often the result of untreated cirrhosis, and by this stage, the liver is unable to regenerate or perform its essential tasks like filtering toxins, producing bile, or making proteins that help the blood clot. Does ESLD mean the end of life? It's important to clarify that ESLD does not necessarily mean the end of life. What it does mean is that the liver's ability to function is severely compromised, and without treatment, complications such as liver failure may occur. But even at this advanced stage, there are ways to manage the disease and improve your quality of life. Symptoms of ESLD. By the time liver disease reaches ESLD, many of the symptoms we discussed in earlier stages become more pronounced. These include severe fatigue, feeling extremely tired and weak. Jaundice, yellowing of the skin and eyes due to the liver's inability to process bilirubin. Ascites, a buildup of fluid in the abdomen, making it swollen and uncomfortable. Mental confusion, also known as hepatic encephalopathy, which happens when toxins build up in the blood. This can cause forgetfulness, confusion, or even coma in severe cases. Severe swelling, especially in the legs, feet, and abdomen. Bleeding and bruising. The liver can't produce enough clotting factors, making even minor cuts or injuries bleed more easily. Managing ESLD. At this stage, managing ESLD is critical for maintaining quality of life. Although the liver damage cannot be reversed, there are treatment options and lifestyle changes that can help slow down the disease and reduce symptoms. Medical management. Your doctor may prescribe medications to reduce fluid retention, manage hepatic encephalopathy, and prevent infections. Diuretics, lactulose, and antibiotics are commonly used. Regular monitoring. You'll need frequent tests to monitor liver function and screen for liver cancer, known as hepatocellular carcinoma, HCC. Paracentesis. For those with severe ascites, your doctor may need to drain the excess fluid from your abdomen. This procedure, called paracentesis, can relieve discomfort and help you breathe more easily. Low sodium diet. Sodium control is crucial at this stage. High sodium levels worsen fluid retention, so limiting sodium to less than 2,000 milligrams per day is essential. This can reduce swelling and prevent fluid buildup. Liver transplant evaluation. For many people with ESLD, a liver transplant may become necessary. If your doctor feels you're a candidate, they'll calculate your MELD score, model for end-stage liver disease, to assess your transplant eligibility. The MELD score ranges from 6 to 40, with higher scores indicating more urgent need for a transplant. What is the MELD score? The MELD score is used to prioritize liver transplant recipients based on the severity of their liver disease. It's calculated using your lab results, such as bilirubin, creatinine, and INR, which measure how well your liver and kidneys are functioning. A higher score means your liver is in worse condition, and you may be placed higher on the transplant list. Generally, a MELD score over 20 is considered serious, and a score of 40 is the most critical. Complications of ESLD. ESLD can lead to several complications, many of which require immediate medical attention. These include hepatic encephalopathy. When the liver can't filter out toxins, they build up in the bloodstream and affect the brain. Symptoms can range from mild confusion to coma. Variceal bleeding. Scarring in the liver can cause blood vessels, especially in the esophagus, to swell and rupture. This is a life-threatening emergency that requires immediate treatment. Kidney problems. ESLD can also impact kidney function, a condition called hepatorenal syndrome, which can be life-threatening without treatment. Infections. People with ESLD are at a higher risk for infections, including spontaneous bacterial peritonitis, SBP, which occurs when bacteria infect the fluid in the abdomen. What can you do to manage ESLD? Managing ESLD requires a combination of medical care and lifestyle changes. Here are a few steps you can take. Follow medical advice. Stay in close contact with your healthcare provider, and follow all medical recommendations, especially around medications and procedures. Monitor your diet. Stick to a liver-friendly diet. This means low sodium, lean proteins, and avoiding processed foods. Caffeine, particularly coffee, has been shown to support liver health, so feel free to enjoy a daily cup. Stay active, when possible. Even light exercise can improve your overall health and circulation, helping manage some symptoms. Avoid alcohol. Absolutely no alcohol should be consumed at this stage. Drinking will only speed up liver damage. Know the warning signs. Stay alert for any signs of severe complications, like confusion, significant weight gain from fluid retention, or vomiting blood. These require immediate medical attention. In summary, Stage 4, end-stage liver disease is a serious condition, but it doesn't mean life is over. With proper management, lifestyle changes, and the right medical care, it's possible to slow the progression and maintain quality of life. If a liver transplant is an option, your doctor will work with you to evaluate your eligibility and next steps. Stay strong, and remember that even in this stage, there's hope for better health. In our next video, we'll talk about lifestyle changes and treatments that can support liver health at every stage of disease. Thank you for watching, and never give up and never give in on your health journey.